30 years ago, I heard the chiropractic message. It radically changed my perspective, to say the least. Shortly after that, I received my first upper cervical adjustment. I remember thinking immediately, I must learn how to do that. For me, the upper cervical adjustment was a practical application that really made the philosophy of chiropractic come alive. All of this led me down a path, of course with the help of others, of doing things like publishing papers, developing a technique, more recently achieving board certifications in diplomate programs, as well as attending 2 others or completing 2 other diplomate programs. All of this was to the purpose of understanding physiology, understanding neurology, all of it in the broad picture of understanding the expression of life from above down, inside out. Through these experiences, I developed a model for upper cervical neurology that can be applied regardless of your technique. It is centered around an examination that you can do that will demonstrate to not only yourself but to your patients that your upper cervical work is having a powerful effect on the brain as well as the body physiology. I want to share this model. I want to make it available for the upper cervical community. I believe this can be a template for all upper cervical doctors to use. Regardless of your upper cervical technique, we are all influencing the cranial-cervical junction with its neurology and physiology. And my encouragement for the upper cervical doctor is this exam not only will impress your patients with your knowledge of the brain, but it will also give you assessment points so that you can understand the impact that your upper cervical work is having on the brain and the body physiology. So join along with us for this upcoming upper cervical neuro boot camp. You're going to learn a ton about the brain and body physiology. It's chock full of clinical pearls, Monday morning ready stuff that you can do that's going to enhance your upper cervical work. We're going to talk about brain development. You're going to understand that better than the average neurologist. You're also going to understand more in depth why we have this epidemic of ADHD, autism. We're going to talk about concussions, our role with that. We're going to talk about how to detect early dementia and what our role is in reversing and help reversing that. We're going to talk about so many things, but really it's wrapped around this idea of the upper cervical neurology model that I spoke of. I really want you to have the benefit that you can put this into your practice as a day in and day out staple for your examination.